Counseling is a technique that helps people help themselves. So it doesn't mean we're giving direct advice to that person, but we're trying to help them help themselves. And the purpose of counseling is to help that person achieve a greater depth of understanding of their own issue and clarification of the problem and mobilize their coping abilities. So it's not an ordinary everyday conversation in which one person asks the other person for advice and gets an opinion on what to do. And that's why it's called a limited supportive activity. Examples of situations where counseling can be required are, for example, breaking bad news, personal conflicts, when the doctor has to inform of a malignancy or a congenital malformation or a stillborn baby, when a person comes to a doctor, for example, with issues related to depression or marriage or family, substance abuse, suicidal tendencies, and many other situations. So the aims of counseling are to establish a relationship of mutual trust and care, in which the people that are receiving the counseling can express themselves fully, give a chance to the patient or their families to seek clarification, allow that person to freely express themselves and their emotions, provide them reassurance, help them achieve a better understanding of their issue based on scientific data, identify the choices and the options that are available for them along with their pros and cons, and help them make a decision that is most suitable for them, mobilize resources that are required to implement the solution, and help them develop skills necessary to cope with that situation. The important thing to remember is that the counselor is not expected to make decisions for the patient. So during counseling, the patient is actually choosing what they want to do. And so the responsibility of the consequences of the solution always rests on the shoulders of the patient and never on the counselor. The do's and don'ts of counseling are, there are many don'ts of counseling. So the first one is, do not ask why questions. Do not say should or ought, because it seems like we're trying to impose our own ideas onto the patient. And don't blame the patient for their situation. Don't compare the patient's experience with your own or give examples from your life. And don't invalidate the patient's feelings. Always acknowledge them. So some things or misconceptions to remember about counseling is that, first of all, counseling does not involve giving direct advice to the patient. So we aren't actually giving them advice, but we're trying to help them help themselves. It doesn't solve their problems for them. It doesn't challenge a patient's feelings and perceptions. And it does not impose the counselor's own views onto the patient. It doesn't make people less emotional, and it doesn't work to fulfill the counselor's need to make people feel better. This means that, for example, if the counselor wanted to help that person feel better, it doesn't necessarily mean that they would feel better. So there are 5 traits that a counselor must have: unconditional positive regard, empathy, warmth and consideration, and clarity and here and now thinking. The most important is obviously unconditional positive regard.